This video will demonstrate the harvesting and preparation of a periosteum patellar tendon bone autograft for an anatomic single bundle anterior cruciate ligament reconstruction. We currently use this kind of graft for the previously described Kojabe press fit tibial fixation technique during reconstruction. The patient is placed supine on the surgical table and the leg holder is removed from beneath the index extremity. The knee is left floating in 90 degrees of flexion. After tourniquet and arthroscopic confirmation of ACL rupture, a longitudinal incision is performed starting from the center of the patella down to the tibial tubercle. The paratendon is carefully dissected, split in the midline with an incision, and retracted laterally. A ruler is then used to mark a tendon thickness of 10 millimeters from the midline of the patellar tendon, and additional marks are added longitudinally to keep the harvesting in a uniform fashion. The patellar tendon part of the graft is then relieved with a blade and freed from the surrounding tissue. Inferiorly, the tibial tubercle is marked in a trapezoidal shape with a length of approximately 35 millimeters, a superior narrow base of 10 millimeters, and an inferior wider base of 12 millimeters. The distal bony end of the graft at the level of the tibial tubercle is cut with an oscillating saw blade. After extraction with a mallet, the graft is then elevated and the patellar periosteum is marked with a length of 30 to 40 millimeters and a width of 10 millimeters and carefully dissected and then released. The graft is cleaned as routine and is then measured. The graft is finally placed into a graft tensioner. The loop of the adjustable fixation device is then brought in and the periosteum is flipped over the loop and measured. A distance of 25 millimeters is calculated for the intra-articular part of the graft, and the remaining superior periosteal flex is clamped together with the proximal part of the patellar tendon. The whole tendon length is then adjusted to approximately 45 millimeters. Starting from the 20th millimeter and working our way proximally, the tendon, the periosteum, and the loop of the adjustable fixation device are fixed with a double needle reinforced loop suture in a whip stitch fashion. After 3 or 4 passages, the needles meet at the distal end of the patellar tendon graft and are then shuttled first through the loop of the adjustable fixation device and then twice from the lateral to medial through the graft. The suture ends are then knot together. Residual soft tissues are then trimmed. Finally, the bone block is then shaped to pass through the 10 millimeter hole of the graft sizer, and the procedure continues as previously described in our technical note.